కిడ్నీ స్టోన్స్ అసలు ఎందుకు వస్తాయి సార్ కిడ్నీలో స్టోన్స్?
We can see that every year the number of surgeries going for.
క్యాన్బెరీ జ్యూస్ హెల్ప్ చేస్తుందా సార్ యూరిన్ ఇన్ఫెక్షన్స్ తగ్గడానికి?
This is also a very common question we get on every day-to-day OPD. See, cranberry juice.
బియర్ ఎక్కువ తాగితే స్టోన్స్ పోతాయి అంటారు.
What happens is when somebody is drinking beer, that might help the stone to come out. But in that place you will.
సో మై డియర్ ఆడియన్స్, అందరూ హెల్త్ ఇన్సూరెన్స్ తీసుకోండి. డిపెండ్స్ ఆన్ ద కలర్ ఆఫ్ యూరిన్. దెర్ ఈస్ ఎనీ ఛాన్సెస్ నో అబౌట్ అవర్ కిడ్నీస్ ఆర్ ఓకే, హెల్దీగా ఉన్నాయి లేవు? యూరిన్ కలర్ పైన డిపెండ్ అయి ఉంటుందా కిడ్నీ ఫంక్షన్?
So normal color of urine is straw yellow. A lot of people tell my urine is yellow color. In general, how the color of urine will help?
మీ సైడ్ నుంచి యూరిన్ ఇన్ఫెక్షన్స్ కంట్రోల్ చేసుకోవడానికి మీరు ఇచ్చే అడ్వైసెస్ ఏంటి, సజెషన్స్ ఏంటి?
Urine infection as such more problem of women. Other thing to prevent, I would suggest small girls. This is very important. I have a small daughter, so I would like to educate people on this. The cleaning should not happen from the.
నమస్తే, వెల్కమ్ టు అవర్ ఛానల్. ఈరోజు మనతో పాటు ఉన్నారు డాక్టర్ దక్షయ్ లఖాని, యూరాలజిస్ట్, అపోలో హాస్పిటల్స్, జూబ్లీ హిల్స్. నమస్తే సార్.
Namaste.
వెల్కమ్ టు అవర్ ఛానల్.
Thank you, my pleasure.
హౌ ఆర్ యూ సార్?
All fine.
వాట్ ఈస్ యూరాలజిస్ట్ సార్?
See, to understand what urologists do, we should know what urinary system is. So urinary system has kidney, ureter, bladder, prostate and penis. So
Okay.
urologists are basically surgeons who do surgeries related to all these things. So any problems in kidney, ureter, problems of bladder, prostate and surgeries of penis, all are taken care by urologist.
ఓకే. నెఫ్రాలజిస్ట్ అండ్ యూరాలజిస్ట్, వాట్ ఈస్ ద
Yeah.
డిఫరెన్స్ బిట్వీన్ బోత్?
Yeah. So this is a very common confusion and question people have, that what does urologist do and what does nephrologist do? So it happens that usually nephrology patient will come to us and urology patient goes to a nephrologist. So as I told, the urologists are surgeons. So all the surgeries of the urinary systems are done by a urologist. Nephrologist will do the disease per se of the kidney. So for example, somebody kidney is gradually getting damaged with the hypertension, with blood pressure. In that case, those diseases are managed by a nephrologist. So you would have heard of dialysis. So a lot of people would be on dialysis. So those dialysis and all are managed by nephrologist. And urologist and nephrologist work together when there are cases of renal transplant. So the surgery of the transplant is done by urologist, but rest of the management of the new kidney is done by the nephrologist. So we work as a team in general.
ఓకే. సో బోత్ ఆర్ రిలేటెడ్ యాక్చువల్లీ.
Significantly related. They both are related to urinary system.
మామూలుగా ఎవరైనా డాక్టర్స్, ఇఫ్ జనరల్ ఫిజిషియన్స్ కానీ ఎవరైనా సరే ఫస్ట్ బ్లడ్ శాంపిల్స్తో పాటు యూరిన్ కల్చర్ ఆ రిపోర్ట్ రాస్తారు. మా యూరిన్ కల్చర్ మస్ట్ అండ్ షుడ్ ఇన్ ఎవ్రీ రిపోర్ట్. అసలు యూరిన్ కల్చర్ ఎందుకు సార్? అండ్ ఆ ప్రాసెస్ ఏముంటుంది? యూరిన్ కల్చర్ ఎలా తీసుకోవాలి ఏంటి అని? అండ్ ఆల్సో ఫస్ట్ యూరిన్ కల్చర్ అని అడుగుతారు. వాట్ ఈస్ ద ఇంపార్టెన్స్ ఆఫ్ ఫస్ట్ యూరిన్ కల్చర్?
So to understand that, we will first see what is urine culture. So urine culture, we just give a sample of urine. They will see that what bacteria is there in the urine. So normally the urine should be free of bacteria. But when we give the sample for culture, they will keep the urine in a culture medium for 48 hours. And they will see that what kind of bacteria is growing, one thing, and which antibiotic is best for the treatment of bacteria. So that is what urine culture is. We just have to give a simple urine sample for it, right? Now, when we are doing urine culture for infection, so somebody wants to see that infection is there, there is no need that we are supposed to give only morning sample. It is called a random sample. So random sample means you can give the sample anytime in a day. but there is a proper way of giving the sample. So
Okay.
whenever we are giving a sample, the urine should not touch anything. It should not touch the finger. It should not touch the side of the skin. The container which we are giving the sample should be sterile. So they will come packed. What happens by chance it touches the skin? Then it will grow the bacteria of the skin. So that is why it should not touch anything. It should be directly into the container. And ideally, we should let the initial part of urine go, and we should take the center part of the urine. Right? So it is called midstream. So the initial stream is thrown away, the midstream is taken. Midstream
Okay.
clean urine sample, it is what as we are
Okay.
supposed to give, and random for the pure urinary infection. Now the question that some doctors advise that it should be given in the morning time. There is one particular indication where the morning sample should be given is when we are searching for tuberculosis. So the
Okay.
tuberculosis of the urinary system, in that the morning sample is supposed to be given, because it takes enough time for the urine to settle, and the sensitivity of those tests might be little bit less. So we want the concentration of the bacteria more in the urine sample. So that is the only indication where we advise to give a morning sample.
Okay.
Otherwise, day on day routine urine sample can be any random urine sample.
సో ఎనీ టైం
It can be
తీసుకోవచ్చు.
anytime.
ఏ ఫుడ్ రెస్ట్రిక్షన్స్ కానీ అలా ఏమీ ఉండవు.
Nothing.
మామూలుగా ఏంటి అంటే ఫీమేల్స్లో యూరిన్ ఇన్ఫెక్షన్స్ ఎక్కువగా ఉంటాయి సార్. వాట్ అబౌట్ మేల్స్?
See, in female urinary infection is quite common, as you just told, because the length of the urethra is less, and the infection can go outside to the urinary system. But in males, the urinary infection is not common, and we take it little bit more seriously compared to women. So in women, if somebody present to us maybe a urinary infection for the first time, we might not force them to do so many tests and all. We might just give them a normal urine culture. We will do a small course of antibiotic. If the person is fine, we just leave them. So, but if the urinary infection is happening again and again in women, then we do more tests. But in males, if we see anyone comes with urinary infection, we need to do test. We cannot just straight away go and treat with the first course of antibiotic. The most common cause why infection can happen in males is obstruction. So if there is any blockage in the urinary system, so if for example kidney is blocked because of the blockage in the ureter, it could be cause of stone, it could be because of stricture, or if the bladder outlet is blocked, that can be because of the prostate. So prostate is one of the very common reason why the urinary infection will happen in male. So if we see infection in male, we are definitely going to do some basic tests like normal ultrasound, uroflowmetry, and find the cause. And then we treat it. Again, the treatment of urinary infection per se would be same like in female, to give an antibiotic. But we always try to find a cause. That is there any other cause which had caused it, and we have to treat that cause also. Otherwise, it is just going to come back.
క్యాన్బెరీ జ్యూస్ హెల్ప్ చేస్తుందా సార్ యూరిన్ ఇన్ఫెక్షన్స్ తగ్గడానికి?
This is also a very common question we get on every day-to-day OPD. See, cranberry juice is definitely helpful, right? But you cannot treat an already infection which has happened. So if somebody is already having a urinary infection, and we think that, okay, let us take cranberry juice and I'll be fine, then it is not. Cranberry juice is not an antibiotic.
Yes.
Right? An antibiotic can treat the bacteria. Cranberry juice helps in prevention of urinary infection. So if somebody is getting urinary infection again and again, they are like every 2-3 months I get infection, then I take antibiotic, then again I have to take antibiotics. So such patients can try to take more cranberry juice. It might help prevention. So how it helps is, cranberry juice has certain chemicals in it which doesn't let the bacteria settle on the wall of the bladder.
Okay.
So once the bacteria settle there, they will proliferate. So if there is, for example, theoretically, if there is a 5 bacteria, you give sometime, they'll become 500 in no time. So the cranberry juice chemicals, that don't let the bacteria settle over it, and that might help in prevention of urinary infection. But expecting that I will take cranberry juice and I'll be fine, that is not the correct way of treating infection.
అండ్ వన్ మోర్ డిసీజ్ ఈజ్ మోస్ట్ కామన్, ఎక్కువగా వింటుంది ఏంటి అంటే కిడ్నీ స్టోన్స్. కిడ్నీ స్టోన్స్ అసలెందుకొస్తాయి సార్ కిడ్నీలో స్టోన్స్?
See, there are nowadays, day by day, we are seeing more and more kidney stones, right?
Yes, sir.
And we can see that every year the number of surgeries going for kidney stones are increasing, right? We also see that there are so many patients where we feel that it could have been completely prevented, right? Why are we seeing more? The probable reason could be our diet and our
Okay.
water intake. So most important is water intake. Most of the people would not be in a proper hydration day to day. They are not taking enough amount of water. Second, people are having a lot of food outside, so a lot of junk food. Whatever food with the fried food which we are taking, it will have lot of salt. So the salt is one of the cause why stone forms. Taking high protein diet also leads to stone formation.
Oh,
Nowadays, everyone
okay.
it is into protein diet.
Protein diet.
Then having lot of aerated beverages outside, the cold drinks and all, that leads to stone formation. Also, more important, the change in the climate. So we are seeing that our summers are becoming hotter and hotter over the years. So people who are working outside, people who are hard working, they will have lot of water loss from the body, and their hydration is not good. So over the times, these are the reasons we are seeing more and more stones coming, and these are the reasons which could have been avoided.
కిడ్నీలో స్టోన్స్ ఉన్నప్పుడు మనకి పెయిన్ వస్తే మనం యూరాలజిస్ట్‌ని గానీ, నెఫ్రాలజిస్ట్‌ని గానీ కన్సల్ట్ అవుతాము. పెయిన్ వస్తుంది మేబీ కిడ్నీ స్టోన్స్ ఉన్నాయని. పెయిన్ కాకుండా అదర్ సింప్టమ్స్ ఏమైనా ఉంటాయా సార్?
So, see, the pain is the most important symptom here, and I'll just tell how the pain is. So, usually the stone pain will start in the loin, so it will be just back
Okay.
beneath the bone where the kidneys are. So, the pain starts there and come to the front of the body, right? Now, lot of people will have back pain also. So, there will be a confusion that is it because of the kidney.
Oh.
So, the classical pain of the stone would be from back and coming to front. It will never be related to your movements. So if you say that when I sit, when I stand, I'm getting pain, mostly it's not because of the stone. So
Okay.
it could be because of the nerve or bone or the muscle. And the nerve pain also goes from the back to the leg. Now a stone pain will not go to the leg. It has to go from back
Okay.
to the front, right?
Right.
And it is very severe. So whenever we have stone in ureters, it causes severe pain. That pain is compared with labor pain, right? So you can understand that
Okay.
how severe that pain would be, and the person would not be able to sit and sleep, and they'll be rolling.
Yes,
with
somebody they can't sit, sleep. They're rolling in the bed at nights.
Yeah. So it is very bad. When I was a student, one of my friend has a stone. At that time, I was not a urologist, and I remember that he was in severe pain at that time. So that was about the pain. As you told that the pain would be there. Now, what other symptoms could be? One of the symptom could be burning in urine. Why?
Okay.
Because the stone would have caused some infection, and that infection now is in the bladder, and the infection leads to burning in urine. That is one thing. Other thing, blood in urine. So if there is a stone there, it can irritate the mucosa of the urinary
Okay.
system, and some blood will come. And usually what happens is, even if there is 1 or 2 drops of blood in urine, the whole of the urine will become red.
Okay.
So people would be worried that, oh, I'm losing a lot of blood, but it would be little bit of the blood, and usually the stone will not cause so much of bleeding that the patient will start losing blood. Only thing is the patient would be afraid seeing the blood coming in urine. That's it. So these are, and fever. So if the infection is there, the person might get some fever. So the most common symptoms which could be because of the stone is pain, then burning in urine, then fever, and blood coming in urine.
Okay.
So when we are seeing any of this, we should think that
We
am I
have to
having a
consult the
stone?
urologist.
That's it.
ఎవరికైతే ఇప్పుడు మామూలుగా కిడ్నీలో స్టోన్స్ ఉంటాయి కదా సార్, వాళ్ళకి ఏంటి అంటే సర్జరీ తర్వాతనో లేదా యూరిన్ త్రూనో స్టోన్స్ వెళ్ళిపోతాయి. తర్వాత వాళ్ళకి ఆ కిడ్నీ ఎఫెక్ట్ ఏమైనా ఉంటుందా? కిడ్నీ ఫెయిల్యూర్ అయ్యే ఛాన్సెస్ ఉంటుందా?
See, kidney failure can definitely happen if we have not treated the stone. So we would have seen that so many kidneys were failed. When the patient came to me, the kidney was not working, and the stone was there since a very long time. They were avoiding the stones, or they were just keep on taking the painkillers, or they would have tried some other treatment like homeopathy, ayurvedic and all. See, I'm not against those treatment, but there has to be some limitation where we need to understand that now we cannot wait more. So we would have definitely removed so many kidneys which were completely
Okay.
failed because that stone was not treated on time.
Hmm.
But I don't want people to be afraid that if I have a stone, my kidney is going to fail. It is
Okay.
not
Just
so fast.
awareness.
This is just for awareness, not
Awareness.
to be afraid of it. It is not like that I have a stone and my kidneys are just going to
Hmm.
fail. It takes a lot of time between the stone has come and the kidney has failed. So you have enough time period in between. If you get correct treatment, the kidneys are going to be absolutely normal.
Okay.
So, and or the other question was after the surgery.
Yes.
So, most of the time, the kidneys would be somewhat affected when the stone is there. We treat the stone, it usually takes some time for the kidney function to come back.
Hmm.
But once the treatment is done, the kidneys are absolutely fine. We need not worry about, unless they were already failed to start with. And nowadays, the surgeries are quite common. The technology is very well developed. We don't need big incisions and big surgeries to do. So, because of all the engineering, the instruments are very minute and fine. The recoveries are very fast. So, I feel the stone surgeries are not like how it was 40, 50 years back. They have completely changed.
Hmm.
And majority of the majority of the stone surgeries are endoscopic surgeries. So, we
Okay.
don't need incisions and suturing and all those things.
ఒకసారి కిడ్నీ స్టోన్స్ వచ్చిన వాళ్ళకి మళ్ళీ వచ్చే ఛాన్సెస్ ఉంటాయా సార్?
Definitely. So if somebody has a stone
Hmm.
and we remove the stone, right? Always understand that if somebody has formed a stone, the body has a tendency to form stones. Right?
Oh,
We
okay.
say that okay, the diet, the water intake are
Hmm.
causing stone. But you would see that the whole of the family is taking the same food, drinking almost
Hmm.
same amount of water, but only one person in the family is getting stones,
Yes.
right? So that means the body of that person has a tendency to form stones again and again.
Hmm.
So if somebody has a stone, definitely there is a chance that he will get the stone again. There are some studies also over it. So studies says there is a 50% chance that in coming 10 years the person will form stone again.
Oh,
So
okay.
somebody who had a stone, he should be little bit more careful
Hmm.
about taking precautions and
Okay.
the water and diet habits to prevent the stones. And
Hmm.
they can even consider getting a little bit more frequent scans, so that even when the stones are small, they are detected and the treatment becomes easier.
Sir, there is any test our kidneys are okay, there is any stone formation, like we are checking regularly, no?
Hmm.
6 months, 1 year, blood samples, health checkups.
Hmm.
There is any test for kidneys specially? There
Yeah.
is any
So here two things uh, about the test. So
Hmm.
there can be two kinds of test. One test is to see if the stone is already formed.
Hmm.
The other part of your question is there any test that we can before only see before
Yes.
formation of the
Hmm.
stone, right? So first we will see that if the stone is already formed, right? A normal basic ultrasound scan is
Hmm.
enough to see for the stone. It is a very basic scan, right?
Hmm.
You can get anywhere on the same day whenever you want. It doesn't have any radiation to the body, so it is
Okay.
normal. Even the pregnant women will be doing the ultrasound scan, so they are very safe.
Hmm.
So that scan itself will find out that are we having any stone or not. When we want to do the surgery for stones, at that time we do CT scans because we want very much detail about it. So that is a different
Okay.
thing. But if my doubt that maybe I have some pain, am I
Hmm.
having some stone, that doubt would be there in the mind. A normal ultrasound scan is done, the doubt is
Okay.
clear. So it is as easy as that. And if somebody has a tendency to form stones, maybe once in a year the person, he or she, can get an ultrasound scan done, and
Hmm.
then he would be happy that I have checked myself.
Okay.
Now other questions is, can we find out before itself that am I having
Hmm.
tendency to form stones or not? So that is one thing is difficult. Second thing is you have to do a lot of tests for
Oh.
that. So we do all those tests only for some reasons. So we see stones even forming in 8 months baby, 9 months baby, so in children. So if we are seeing that very small kids are having
8
stones,
months baby, just they are taking milk only, no? Sir?
yeah, so
How?
that is, so they might have some reason. Recently we had an 8 months baby who had almost 4 centimeter stone. So 4 centimeter is a this much
Yes,
big
sir,
stone,
very
and the
big.
whole of his kidney was filled with stone. Right?
Hmm.
And we had to remove it. It was all fine. So such a small kid, we have to be a little bit more careful because the anesthesia for babies are difficult and all. but it was fine. We were happy with the process. So in such cases we would like to do some test, that why such a small baby got a stone,
Yes,
right?
sir.
So there would be many blood tests to see that are there any chemicals in the body which are very high in number. So for example, somebody's calcium is too high,
Okay.
somebody's oxalate is too high, somebody's uric acid is too high.
Okay.
So all these chemicals, if they are too high in the body, they will form stones, right? Second
Okay.
thing, if there is some abnormality in the urinary system, so if the urinary system is blocked by birth, so in intrauterine, in the mother's womb only, the urinary system was blocked, for example, then the urine cannot flow down. If the urine cannot flow down, the stone formation will happen.
Okay.
So then we will do all the test. But in an adult person, day to day life, when we see stone, we don't make them do so many tests, because 95% of the stones are made of calcium oxalate. So
Okay.
even if we send the stone for analysis,
Hmm.
the reports are going to come as calcium oxalate. It will be unnecessary adding cost to the patient, right?
Hmm.
But as I told you, the children having stones, then somebody having recurrent stones. So for example, somebody had a huge stone, I did a surgery, again 6 months he found a new stone. So they are called recurrent stone formers. For them, we might consider doing a lot of blood tests to see, as I told you, calcium oxalate, uric acid, citrate, and the pH of the urine, the specific gravity of the urine. So there are a lot of tests, parathormone. So all this test we will do to see that is there any reason why they are forming.
యూరిన్ కి కూడా pH ఉంటుందా సార్?
Yes,
అవునా?
pH means the acidity and
Yes,
alkalinity.
basic.
Yes, yes. So urine pH normally will range between 4 to 8, right? And in an acidic urine, there is a more chance of having a urinary infection and burning in urine and all. So you would be seeing that we advise some syrups, citralca. It is a very
Citralca.
everyone would know
Come on,
what it, right?
come
So it's a very common, right? So what is citralca? It is an urine alkalizer. It changes the urine pH to more alkaline. So that can prevent urinary infection, and also it might help in burning. But just for the knowledge, even the lemon juice is urine alkalizer. So we need not keep on taking the syrup outside when we have some home remedy there.
Lemon juice is best.
That is fine. So if somebody is having very significant urinary infection, then we can use the syrup and all. But on a day-to-day life, if I'm having recurrent urinary infection, I cannot keep on drinking that syrup again and again. So I should make a habit that, okay, I'll have a little bit more lemon juice in my day-to-day.
బియర్ ఎక్కువ తాగితే స్టోన్స్ పోతాయి అంటారు. అది నిజంగా మితా ఫ్యాక్ట్ సార్?
No, this is a very common question asked to me in the OPD, that people think that we drink beer and the stones will come out, right? So life is not that happy. It is not like that, right? It is a proper myth, right? It is very wrong thinking that drinking beer will treat my stones or it will bring my stones out. What happens is, when somebody is drinking beer, the beer also has a water content in that. So whatever water content is there in the beer, that might help the stone to come out. But in that place, you will just drink water. So that is the best thing. Also, what happens is, beer over the long run can lead to stone formation. So after taking beer, usually a time period would be there where the body would be dehydrated, because the beer is a concentrated drink. So there will be hangovers on the next day in the morning. So beer or any alcohol would dehydrate the body for some time period. So we know that when somebody is dehydrated, there is more chances of stone formation. So drinking beer is absolutely a myth that it helps. We are only supposed to drink more and more water. Other things, you can have coconut water, that is fine. You can have lemon water, that is fine.
ఎవరికైతే కిడ్నీలో స్టోన్స్ ఫామ్ అవుతాయో వాళ్ళందరికీ సర్జరీ మస్టా సార్?
No, definitely not. So if I have a stone, doesn't mean that I will need a surgery, right? So is there any need of surgery? Depends on many factors. First factor is where the stone is. So people say that stones are always kidney stone. It is not like that, right? Stones can be in the kidney, it can be in the ureter, it can be in the bladder, right? Now the treatment of all these stones are different, right? And because people should understand that. I see on an everyday life that people don't understand that stone can be at different places.
Okay.
So doing a procedure for a stone in ureter, it is difficult. So if it is a 5 stone in ureter, sometimes it might be difficult to treat it. And if it is a very huge stone in bladder, it is very easy to treat it. Right. So first, coming back to your question, that does all the stones need surgery? So it is not like that. If the stones are very small, so imagine somebody is having 5 6 7 stones, they don't need surgery. So there are some tablets that which we give for the stones to come out. So how does those tablets work is they dilate the ureter. So the urinary system, there is a kidney. There is a tube beneath the kidney which is almost 20 centimeter in length. It is called ureter, which opens into bladder. Right. Now this ureter is very thin. It is like the refill of the pen. It is that thin. So when the tube is that thin, any stone can block there. Right. So if it is a 5 to 7 stone, right, we can give some tablets which will dilate this tube so that the urine will the stone will come out easily. Right. So some tablets are that, and meanwhile the patient might be having pain, so we give some painkillers also, because we don't want the patient to be in pain while all this process is happening. But we should also understand that every body is different. Right. So I have seen that some patient has even pass of 10 stones. So 10 are big stones. So 10 to 12 stones also can come out in urine. And we have also seen 3 stone not coming out. So it is very different for everyone. But in general, when somebody comes to me and tells that I have a 5 stone, I have a 7 stone, we don't tell them to get the surgery done. Just wait for some time. Try for the stone to come out. We can definitely wait 2 weeks, 3 weeks. We can wait if the fever and other issues are not.
Any weeks, 2 to 3 weeks wait is the pain continue.
So usually what happens is the stone pain will not be continuous. How the pain comes in, the pain will come sudden, and it will be very severe. As we were discussing that the patient would be rolling for pain, then suddenly the pain will go off, and the person would be absolutely fine for hours or days, and then suddenly the pain will come back. So that is why it is compared with labor pain. So labor pain, when the contraction happens, the pain will be there. Then in between it will be fine. Then again the pain will come. And also the pain is a little bit different for everyone. So some people will have a lot of pain. Some are fine with big stones. They are fine. So in general, if we wait for 2 to 3 weeks, it is fine. But sometimes we will tell that, okay, we don't want to wait. So what are the times we don't want to wait? As you told, if the pain is very much, the person tells that I don't want to bear this pain. So we can consider the procedure. If somebody is having fever, fever is very important. If the fever is there, that means there is infection in the body or the urinary system. So we should not be waiting. Or if we see that a lot of blood is coming out, then there will be a lot of anxiety in the family, that blood is coming in the urine, the person would be stressed. So if these things are there, then we will tell them, okay, let us not wait, we will do the procedure. But if these things are not there, definitely wait for some time. Because if the stone just come out, we can avoid a surgery. We can avoid giving anesthesia. Any surgery is definitely a little mental stress to the patient, to the family. And see, as surgeon, I might think that these are small surgeries, but for a person who is not a doctor, for them, surgery is a very big thing. So if we can avoid any procedure on anyone, we would definitely like to avoid.
What about prices, sir? These are reasonable prices?
Prices will definitely vary from hospital to hospital, right? So but I would suggest that always have medical insurance. Right? Health insurance is very important. As I wish that all the complete population of India has medical insurance. So that is what something I wish. Maybe obviously government is doing their own part, right? But we are a very highly populated country.
Yes, sir.
So to the family, I would suggest that always have medical insurance. So if my own insurance, right, I have an insurance which I pay 15,000 a year, right, and it covers me for 10 to 20 lakhs. And so 15,000 a year is almost 1,500 a month.
Yes,
so that much money we should try and give for the health, because then you are getting a very good coverage and there will be very less pressure on the family, right? Otherwise, since the technology has developed too much, these technologies are also costly, and the cost of the surgeries are high, and they will become maybe higher and higher as the day pass. So we don't want that. For some surgery, sometimes I hear patient that I had a surgery, I had to sell the land. So we feel very bad that
Yes, sir.
you cannot be using your family savings for the health. So I feel that everyone should be having the health insurance. Then you don't have to think about what the cost of the surgery.
సో మై డియర్ ఆడియన్స్, అందరూ హెల్త్ ఇన్సూరెన్స్ తీసుకోండి. వన్ మోర్ థింగ్, ఇప్పుడు సర్జరీ ఎవరికైతే అవుతుందో కిడ్నీ స్టోన్స్ వల్ల, దే హ్యావ్ టు యూస్ ద మెడికేషన్ కంటిన్యూస్లీ, ఓన్లీ దే హ్యావ్ టు యూస్ ఓన్లీ ఫర్ సర్జరీ,
No. See, so during
లైక్ క్రోనిక్ మెడికేషన్.
chronic, not required. See, normally day-to-day stone surgeries will be going on. We would be giving them some tablets around the surgery time period. So
Yes.
maybe 5 days after the surgery, and some this citralca syrup and all, maybe 2-3 weeks we can take it. But it's not like that we should be taking for months together, right? We never know that those stones are going to come back. Otherwise, it is too much of cost. All those tablets might have their own side effects, and
Yes.
so and the patients might be taking other tablets also. So when there might be some 10 tablets the patient is already taking, and then you add more tablets, it might have some interactions between the tablet. So we don't want patients to be taking the tablets for a long time period, right, for stone, unless there are some reasons that particular reasons why the stones are there. So some people might have some parathyroid issues. So and some patient might have high uric acid in the body. So if the uric acid is always high in the body, they will form uric acid stones. So there are some tablets which keeps the uric acid in the blood in control, so that the stones are not formed. So for those reasons they can take tablets for long. But in general, the stones day to day are formed. Long term tablets, chronic tablets are not required.
ఎవరికైతే డయాబెటీస్ కానీ బ్లడ్ ప్రెషర్ కానీ ఉంటుందో, ఆ ఎఫెక్ట్ కిడ్నీ స్టోన్స్ అలా ఫామ్ అయ్యే ఛాన్సెస్ ఉంటాయా సార్? ఆ ఎఫెక్ట్ ఉంటుందా?
It can. So in general, the study says that person who is having diabetes, they have more tendency to stone formation. So what happens is, the kidney is a very complicated thing. It has to throw out something, it has to retain
Yes,
some factors, and it happens at a very microscopic level, right? Now people who are having stones and hypertensions for a long time period, they will have some damage to the kidney. So for years together, 15 years, 20 years, they are having that. So that damage to the kidney can lead to stone formation, because the functioning of the kidney will not be as good as it is for normal. Other thing is, diabetic patients, they are very prone to infection, right? And the infection of the urinary system is one of the cause stones can happen. So there are a certain kind of stones which are called like triple phosphate stones. They are called struvite stones. So those stones are formed in an infected urinary system. So that is the reason that diabetic patients have little bit more tendency to stone formation. But they don't need to do anything extra for it. They just have to have the sugars as much as controlled. That's it.
అవి రెండు బ్యాలెన్స్ చేసుకుంటే చాలు, డయాబెటీస్ అండ్ బ్లడ్ ప్రెషర్.
And also salt intake, as we discussed. So anyways, hypertension patient has to decrease the salt intake.
Yes.
Which is good.
ఓకే, సాల్ట్ ఎఫెక్ట్ కూడా ఉంటుందా సార్ కిడ్నీ
Salt,
పైన?
see, I will tell about the diet of a person who is forming stone, right? So what is the scientific diet a person who is having stones again and again, which the person should take? So it has to be low protein, right?
Okay.
So taking a large quantity of red meat and taking on an everyday basis should be avoided, right?
Okay.
So one is low protein, second is low salt. So if your diet is having too much of salt, we have to reduce the salt, because both of this leads to stone formation.
Okay.
Third thing is moderate calcium, right? So here, this is one more myth which I heard frequently, that people ask that, okay sir, what stone is made of what? So I'll be like, it is made up of calcium oxalate. Then they're like, I will take less calcium then, right? It is a very obvious thinking.
Yes.
But if you take less calcium, you will have more stone formation. There is a reason to it. So what happens is, calcium and oxalate, they get chelated together,
Hmm.
right? Now if you the oxalate is there in the stomach, and if you take calcium, then calcium and oxalate will
Binds
chelate
it.
bind to
Hmm.
each other, and it will not be absorbed.
Hmm.
So if you think that oxalate is there and now you are taking calcium very less, there is nothing for oxalate to bind. Then the
Yes.
oxalate will go into the blood, and the oxalate will go into the urine. In the urine, it will
Okay.
bind with the calcium, and it will lead to
Okay.
stone
Okay.
formation. So taking less calcium will prevent the stone is absolute myth. We have to take moderate calciums. So there is one more doubt which I get asked every day is old patients will be taking calcium tablets. A lot of women will be on
Yes,
calcium
sir.
tablets. So they have stone. They will ask me that I have calcium stone. Should I take calcium tablets? So you are supposed to take calcium tablets. That is why the diet is high protein, low protein, low salt, moderate calcium,
Okay.
and high hydration.
Okay.
Lot of water in the day, right? Now out of all this list, high hydration is most important. If you are not
Okay.
drinking proper amount of water and then you are doing so much control in diet, it is of no use.
సార్ కిడ్నీ ఫెయిల్యూర్ ఉంటారు కదా మామూలుగా ఇప్పుడు చాలా మందికి ఒకే కిడ్నీ ఉంటుంది
Mhm.
దే ఆర్ సర్వైవింగ్ విత్ ఓన్లీ
One
వన్
kidney,
కిడ్నీ వాట్ అబౌట్ దెమ్ సార్ హౌ మచ్ వాటర్ దే హ్యావ్ టు టేక్ మీన్స్ ఎక్కువ ప్రెషర్ ఒక కిడ్నీ పైన పడుతుంది కదా ఎక్కువ తాగొచ్చా లేదా
See, as you told, lot of people will have one kidney. So, how God has given is one kidney in general is enough, right? So, it is enough to do all the function. So, that is how renal transplant work, right? If I donate my kidney to someone, right? So, my one kidney would be removed, right? My life will be absolutely normal until the other kidney is working well, right? So, we should understand, and so many babies will be born with one kidney, right? Their life would be absolutely normal. A lot of people don't even know that they have one kidney, right? One of my family relative, he is some 10 years old now. He got a scan done for something, there is only one kidney. He never realized that he was born with only one kidney. So in general, one kidney for working of the body is absolutely fine, right? And that person doesn't need any restrictions. So
Okay.
normal water intake. So ideally we should be drinking 2.53 liters of
3
water
liters,
in a
yes.
day. So that much he can take. Water restrictions come when the kidneys are failing. So if
Okay.
the both kidney together or one kidney is not able to filter properly, then that person requires some restrictions in diet and water.
Okay.
How we come to know? We will do some blood tests like serum creatinine and all. So from that we will come to know that the kidney is not functioning well. The restrictions come then.
Okay.
Otherwise we don't need any
No worries
restrictions, and 2.53 liters of water intake is good enough.
సార్ చాలా మందికి కిడ్నీ పేషెంట్స్ ఎవరైతే ఉంటారో వాళ్ళకి లివర్ రిలేటెడ్ ఫ్యాటీ లివర్ అవి ఎఫెక్ట్ అవుతుంది లివర్ ఎఫెక్ట్ అవుతుంది అంటారు అది
It won't. So the fatty liver finding is just a separate finding per se.
కిడ్నీ ఏం
It
రిలేటెడ్
has not related.
చాలా మంది అనుకుంటారు యూరిన్ చాలా సేపు హోల్డ్ చేసి ఫోర్స్ఫుల్ గా యూరినేషన్ చేస్తే స్టోన్ బయటికి వచ్చేస్తుంది అంటారు ఈజ్ ఇట్ ట్రూ సార్
No, that is also a myth. It doesn't have a logic. So imagine, as I told you, we have kidney, then we have a tube which is ureter, then we have bladder, and then the urine will come out, right? Majority of the stones which we are discussing are in the kidney and in the ureter,
Okay.
right? Now, if you hold the urine so much, urine will be held in the bladder, and you pass forcefully, it will just come out. It has nothing to do with the kidney and the ureter.
Yes.
So how can it help, right? It has no logic that the kidney stone or a ureter stone, if you hold it too much and pass with force, it will come out. No, actually it will even worsen it, because you are holding urine with for so much time period. You are giving more time for the urine to stay everywhere, and the stone can even become bigger because the urine is not getting clear. So it's an absolutely myth, and actually it is bad to do that.
సార్ ఇంకొక డౌట్ ఏంటి అంటే ఎవరైనా ఏ డాక్టర్ అయినా మామూలుగా యూరిన్ కల్చర్ ఎందుకు రాస్తారు సార్ ఇన్ ఎవ్రీ రిపోర్ట్ యూరిన్ కల్చర్ ఎందుకు అని
See, one thing is, in every report it should not be done. So if somebody
బేసిక్ హెల్త్ చెకప్స్ ఆర్ బేసిక్ టెస్ట్ ఎవ్రీవేర్ యూరిన్ కల్చర్ ఇస్
It is there, but we need to avoid it. I feel it is unnecessary cost to the patient. If there has to be some reason why we are asking some test. So as a doctor, when we are becoming doctor, when we are learning, we are always told that if I'm writing a test, there should be some reason in my mind that why I'm writing the test. I cannot just keep on writing the test. Then there are thousands of tests, right? I cannot do so many tests. So urine culture we do when we want to see that which bacteria infection is there, which antibiotic is good. So that means I am doing culture when I have already suspected an infection, right? Now, before doing urine culture, we should do a normal urine test. In the normal urine test, if we are seeing pus cells, right? So, or we are seeing some blood. So then there is a sign that maybe infection is there. And then the next step has to be urine culture. But if somebody's normal urine report is showing no pus cells, we should not be doing culture. It is unnecessary cost. And apart from the cost, it is we have to follow the report after 48 hours. It is a lot of work for the patient. So these things, as doctors, we should understand that writing some test is easy for us, but doing all those steps is not easy for somebody. They have to wait in line, they have to collect the report. Until the report comes, they are worried that what the report will come. So urine culture should not be done all the time. It should be done whenever we are seeing some signs of infection in normal urine.
One more thing, sir. Depends on the color of urine. There is any chances no about our kidneys are okay, healthy ga unnayi levo. Urine color paina depend ayi untunda kidney function.
No. See, many years back when we didn't have test and all, 50 years, 60 years, 100 years back, when all the technology tests were not there, at that time it was okay. That just seeing the color we used to try that what it is. Now we are not in a time period where we should just wait for the color, but we should have some basic understanding how it is. So normal color of urine is straw yellow, right? So a lot of people tell my urine is yellow colored. That is a normal color urine. Straw yellow.
పిల్లలకి కూడా యూరిన్ ఎల్లో కలర్ లో వస్తే మా యూరిన్ ఎల్లో కలర్
so people are worried. No, the normal color of urine is a little bit yellow tinged color. So in general, how the color of urine will help us is it helps us that are we drinking enough water or not. So if you are seeing more yellow color urine, dark yellow color, that means we are not drinking good water. So lighter little bit yellow is fine. If we want to too much, if we drink too much of water, it will become transparent, right? Colorless. So that is where it helps. Or if it is red in color, then we know that maybe blood could be there, right? Infection could be there. Then some tablets can change the color of urine. So for example, somebody is on tuberculosis treatment, they will have orange color urine because of the one of the tablets in there. So, and there are some disease where the urine can become black in color, right? But those things are very rare. In general, we don't have to think much on that. In general, for the people, the color of the urine should be used for the hydration. If the we should see that it is not too much concentrated in color and we should drink more water. That's it.
కొంతమంది ఏంటంటే యూరిన్ పాస్ చేశాక వాష్రూమ్స్ కానీ సరౌండింగ్ ఏరియాస్ కానీ బాగా స్మెల్ వచ్చేస్తాయి. సో స్మెల్ ఎందుకు వస్తుంది? డిపెండ్స్ ఆన్ ఏదైనా ఫుడ్ ఇంటేక్ వల్ల, టాబ్లెట్స్ వల్ల వస్తుందా, లేకపోతే వాళ్ళకి ఏమైనా కిడ్నీ ఫెయిలియర్ ప్రాబ్లమ్స్ ఉంటాయా సార్?
So see, just there is some difference in smell of the urine doesn't mean that a person is having some disease. So as we were discussing the pH of the urine, so sometimes when there is a difference in pH of the urine also, it can lead to smell of the urine. So we get many patients will be like that, sir, when I pass urine there is some smell which was not there before. We do all the tests and everything might turn out to be normal, right? So just the first basic thing we need to do is just increase hydration. So when we take more water, whatever chemicals are coming, they are going to get diluted and it will help. Other thing is to use urine alkalizer. So when the urine is more acidic in urine, it might lead to the smell of the urine. So urine alkalizer will help in that. Other, as we discussed, we can have some lemon juice in that, right? Sometimes some infection with a particular kind of bacteria can also bring some smell in urine. But once that comes in the report, we can just treat that bacteria with some antibiotic and it should be fine. But the question is just some change in smell of urine, my kidneys are bad or anything. It's nothing like that. Should not just worry because of the
Okay.
order of the urine.
రీసెంట్‌గా ఈ మధ్య కొంచెం ఎక్కువగా వినేది ఏంటంటే టెస్టిక్యులర్ టార్షన్.
Hmm.
చాలా మంది భయపడుతుంటారు.
Hmm.
వాట్ ఈస్ టెస్టిక్యులర్ టార్షన్? ఏజ్ గ్రూప్ ఏదైనా ఉంటుందా పర్టిక్యులర్‌గా ఈ ఏజ్‌లో వస్తుంది అని?
Hmm.
ఏంటి సార్ ఎక్స్‌ప్లెయిన్ చేస్తారా?
Yes, very important because a testicular torsion is an emergency,
ఓకే.
right? So it is very important for people to understand what is testicular torsion, right? Now, see, testicular, as the name suggests, torsion means the testis gets rotated.
ఓకే.
Now, when the testis gets suddenly rotated, the blood supply to the testis is blocked. So there is a very small time period in between where some step should be taken, right? So now first thing we will start is age group, right?
Okay.
Usually the age group is in teenage.
టీనేజ్.
So teenage boys around 14 to 20 years are the common who are having testicular torsion, right? Now why it happens and why in teenage, right? So why it happens is by birth there are some certain anatomy of the testis which makes it for the testis easy to rotate, right? So it is a little deformity. It is not a disease. It is just how the anatomy is, right? So there is something called bell clapper deformity. So such kind of testis can rotate, right? Now it will be there by birth, but when they reach the age of puberty, right, suddenly the testis size will increase and the weight of the testis will increase.
ఓకే.
It makes it more prone to rotate. That is
Okay.
why it is more common in that
ఏజ్.
teenage
ఓకే.
group. Usually once they cross some age above 30 years, we see very less testicular torsion, right? And it can happen anytime. It can happen while somebody is playing sports. It can happen even when somebody is sleeping, right?
స్లీపింగ్.
Yeah, the person would be sleeping and they'll get up with the torsion, right? Because the muscle around the testis, there is cremasteric muscle. That muscle is very active in teenage group. So that muscle movement itself lead to rotation of the testis. It can happen while in sexual activity. It can also happen. So these are the reasons why torsion can.
How we know, sir, it happens?
Yeah.
There isn't any pain?
Yeah, it will be with pain, right?
Oh, okay.
So luckily God has given pain, because if the pain would not have been there, we would never realize that
Nobody's
the torsion
known,
has happened.
yes.
So when it rotates, it would be severe pain, first thing. Second thing, there will be swelling of the
Swelling,
testis,
okay.
right? So that will give us an idea that maybe torsion can be there. In general, I would say any teenage boy in age of less than 20 years, if he says any complaint of testis, we should just scan it.
Okay.
So scan is nothing but an ultrasound scan. Immediately they scan and they will say that there is a torsion or not.
Okay.
So I would like to tell to the audience that do not wait. If there is a boy who is less than 20 years, he tells me I have some testis pain, immediately take him and get a scan done.
Okay.
Because here the time is very important. Ideally, the surgery should be done within 6 hours. So once the twisting happens, if within 6 hours we start the surgery, there is a chance we will save the testis. So we don't have to do anything. We untwist it
Okay.
and fix it. Right? It is a small surgery. It is not a major surgery, but it is important. The time duration is very important.
Okay.
So if we do it within 6 hours, there is a 90 to 100% chance that we will be able to save the testis.
ఒకవేళ ఇగ్నోర్ చేస్తే
So
ఏమవుతుంది?
if we wait for 24 hours, if we wait for 1 day, right, then the chances drops down to 10%.
Okay.
So many patients, they will have testis pain. They will be like, okay, we will see till tomorrow. If it is continuing, then we will go to the doctor, right? Or they might they will ask some family friend that some pain is there. They will tell, okay, you take some Dolo, take some painkiller, right? Then you waste this 24 hours in this time period, then we might lose the testis. So there are some problems we should be very active. And the moment we realize that, it should be just treated. So many times they will go to doctor, the doctor will tell surgery is required. They will be like, no, I will ask another doctor. I will ask another
Yes,
doctor
sir.
tomorrow. So when you are
టైం
waiting,
వేస్ట్ చేస్తారు.
That's it.
సెకండ్ ఒపీనియన్,
That's
థర్డ్
it.
ఒపీనియన్.
that's it. So there are some problems where you can take second, third, 10 opinion you can take. there are some problem which we have to move very fast. So torsion is one of the reason. Should be very serious. Everyone should know it. Recently, it was very famous in the media. That is at least one of the reason why
Awareness.
somebody is talking.
ఒకవేళ ఇది ఇగ్నోర్ చేస్తే ఎలాంటి కాన్సిక్వెన్సెస్ ఫేస్ చేయాల్సి వస్తుంది సార్?
So imagine that somebody has a torsion, he didn't come for 2-3 days, right? So now the blood supply of the testis will be gone. So that testis has to be removed. So they come to the hospital, we open it, it will be some completely black mostly. So we remove that testis, right? Anyways, now it will not be working. One important thing, for example, right testis has become torsion. Now it is gone and we have removed it. We are supposed to fix the left testis. So a small surgery is also done on the other side, and we fix the testis in a such a way that it will not tort. Otherwise, imagine that one testis is gone. After 1 month, the other testis also get torsion. So to save that testis, now one testis is gone, only one testis is there. To save that testis, we will fix the testis. Right? Again, God is always helpful to us. God has given 2 testis. So if one testis is there, the life is still normal. We don't have to worry everything, his sexual life, his fertility, everything will be normal. But he should take care of the only testis which is left. It should not happen that he had some accident or some sport injury in future. So the person should be little bit careful, but should not worry. And see, this could have been prevented, right? If they would have done the surgery in a right time, it could have been prevented. Also, one more knowledge people should have is there is something called silicone testis. Right? So if one testis is, it is like implant, right? So if one testis is removed, we can put a silicone implant wherever the testis is removed, but it will give only cosmetic. It doesn't work for for the cosmetic. If some person is like psychologically doesn't like the testis is removed, then a silicone testis can be placed.
Okay, psychological డౌన్ అవ్వకుండా ఉండడానికి అలా చేస్తారు.
That's it.
ఓకే, దానివల్ల అయితే ఏం బెనిఫిట్స్ ఉండవు.
It won't help. It will be just cosmetic.
One more thing, sir. What is vasectomy, sir?
So vasectomy is male sterilization, right? So we know, everyone know tubal ligation, right? So when the women is there, the children family is complete, they will get tubal ligation to stop the further pregnancies. The same thing in male. So male sterilization is vasectomy, right? Now, what is vasectomy? See, there is something called vas deferens, and ectomy is removal of that part, right? So the sperms are produced in the testis, right? Now there is a tube which connects the testis to the penis, from where the semen will come out. So this tube is called vas deferens, and cutting the tube is called vasectomy. It is a very small procedure, right? And we have to do it on both the sides. It is an easy procedure. So once the vasectomy is done, the sperm content will not be there in the semen, right? So we should understand only sperms will not be there in the semen. The semen would be normal. So a lot of people think that if I get a vasectomy done, my semen will not come out. No, the semen will absolutely come out like normal, right? The people say that the quantity will become very less. No, the quantity might reduce only by 2% to 3%. The person will not even understand that it has become less, right? So I'll tell you how the procedure goes and how it should be followed, right? So procedure is a very small procedure. The person, it can be done without anesthesia also. So it can be done under local anesthesia. So complete general anesthesia not required. Spinal anesthesia not required. Local anesthesia, it can be done. It takes small, maybe 15-20 minutes. The procedure would be over, right? The recovery time period very fast. Patient doesn't have to stay in the hospital. Same day will go home. He will take tablets for 4-5 days maximum, and that can be stopped. There won't be any big cuts anywhere. It can even be done without any stitching. So even stitch is not required. It is called no scalpel vasectomy. So there is no cut, no stitches, and it can be done. The person can start working immediately. So if there is a light work, sitting work, maybe after 1 day he can start doing it. If the person is doing heavy work, a lot of, then maybe 1 week little bit rest he can take and start the heavy work also.
Okay.
Other thing is, will it work immediately?
Hmm.
So it will not work immediately. We have to wait for some time periods. Maybe for first 3 months we have to use some protection.
Okay.
After 3 months it should be fine.
Hmm.
So how, or at least first 20 ejaculates,
Hmm.
the sperm might still be there, because whatever sperms are left in the tube, they have to come out.
Okay. Okay.
So for coming 20 ejaculates, the sperm will be there.
Hmm.
And after that, the sperms will stop coming from there.
Okay.
Even it can be checked once in semen analysis, and then the protection can be stopped.
Oh.
Right?
Oh.
So the procedure is a very small procedure. Surprisingly, what happens in India is, for every one vasectomy, 100 tubectomies are done. Right?
Okay.
Now, tubectomies are not small procedure, right? So they are done through the abdomen. They are
Okay.
done laparoscopically.
Hmm.
So vasectomies are smaller procedure than tubectomies.
Okay.
Vasectomies has less chance of complications than tubectomies.
Hmm.
Right? But in our society, tubectomies are far more common. One of the reason could be, when other surgeries are going on for any women, they will consider the tubectomy is done simultaneously. But the rate of vasectomy also should increase over the time period. Maybe it is little bit unfair to the women that the procedure always
It's,
they have to.
ఈ ఫ్యామిలీ ప్లానింగ్ ఎక్కువగా ఉమెన్ లోనే
Exactly.
prefer
So we have
చేస్తారు.
kept the responsibility of family planning on women, but it has to change, and it is over the time changing. So more and more educated people,
Hmm.
they are opting for vasectomy. The problem is, people have lot of misinformation. They think that if a vasectomy is done, then my sexual performance will
Yes.
come down,
Hmm.
and I will become very weak. As a,
Hmm.
all these things
Nonsense.
are complete nonsense, and it has no logic behind
Hmm.
it. Right? So vasectomy has nothing to do with sexual performance. It is a completely separate way it happens. Right? And it will not cause any weakness in the body. Nothing. It is a
బిఫోర్
very
ఎలా
small.
ఉన్నారో అలా ఉండొచ్చు.
Absolutely,
After the
absolutely like
Hmm.
that. And one other doubt is, can we reverse it? Right? So once it is done, so what happens is, it should be considered as a permanent only.
Hmm.
There are some ways to reverse it. We can again, what vasectomy, there is a tube.
Hmm.
We have cut the tube and we have tied the both ends separately.
Okay.
So we can again open it and again suture it back.
Okay.
But it is not 100% guarantee that that will work.
Hmm.
So
Okay.
that's it. Usually the decision should be, people will make the decision when the family is complete. In a very rare case scenario, the need would arise that people want to
Okay.
suture it back.
కొంతమందిలో ఫ్రీక్వెంట్ యూరినేషన్ చూస్తుంటాం సార్. ఇట్ ఈస్ గుడ్ ఆర్ బ్యాడ్?
No, see, it is nothing like good or bad. The problem is, it affects the lifestyle. So
Okay.
for example, if somebody is saying that I have lot of frequent urination, I have to pass urine again and again. Whenever I go and pass urine, only little bit urine will come. Right? So it is little bit difficult on day-to-day activities. Imagine somebody is traveling in a bus for 10 hours, and then you have to pass urine every 1 hour. You cannot tell the driver to stop the bus every 1 hour. And then there is a lot of feel and urgency of urine. So that would be little bit difficult in a day-to-day life, right? And somebody, imagine having a frequency in the night time. So they have to get up again and again. Their sleep is disturbed. If the sleep is disturbed, next day the person is weak. So that is an issue for majority of the patients, right?
Yes.
So whenever somebody comes to us, for example, that I have frequency, I have to pass. So normally passing urine 4-5 times a day is okay. But if we are passing 8 to 10 times in a day, again you are getting up 3-4 times in the night, then it is abnormal. Then we have to find a cause, that is there any reason why this is happening. So if in females, if we consider, then the most common reason is infection. First see the infection, treat the infection. If it comes down, then we don't have to do anything, right? Other reason could be overactive bladder. So again, passing urine is a very complicated thing coming from the brain, because we don't think this way, but it is very nicely placed by the nature. So whenever the urine is coming in the bladder will keep on filling to one point. Then the bladder will tell the brain that I am full now, right? The brain will decide that is there any washroom here. So whenever you are reaching to the washroom, the brain will again tell the bladder, okay, right now
Yes.
we're in the washroom now. So it's a very complicated thing. We don't think that how these things are working
Yes.
so well. Otherwise, if brain tells the bladders anytime that yeah, we are full, then the person will leak urine there. So sometimes what will happen is there will be little bit misfiring from the brain, right? And there might be some changes in the bladder. So bladder will pump even when the urine is not there enough. That is called overactive bladder. So even if the bladder is filled little bit, the bladder will pump. So a person will feel, I want to pass urine. He will go to the washroom, only little urine will come, again he will come out. Again the bladder will pump. That is called overactive bladder. And there are some tablets which help in those conditions. So they will little bit relax the bladder. So then the frequency of urine will come down. And these are the tablets don't have much.
ఏమైనా సైడ్ ఎఫెక్ట్స్ ఉంటాయా
So the tablets doesn't have many side effects. And new tablets are coming whose side effect profiles are better. So their side effects is less than the before. Before the tablets used to come, it used to cause some dryness of mouth and some constipation. Right, so those are the common side effects of those tablets. But the newer tablets which have come, which we are using regularly, they don't have much side effects, right? And you don't have to take every day like antibiotics.
ఓకే
Antibiotics, you are like, if 5-day course is there, you have to take 5-day course. You cannot take today and then take after. So these tablets are not like that. You can use on SOS basis. For example, you have a long travel, or you have a family function, or you are staying in somebody else's house, then you are not comfortable going to. So in that time period, you can use these tablets. You don't need to take it on an everyday basis. There are some tests also to confirm that is there overactive bladder is there any neurological issue is there. So those tests are called urodynamic studies. So they will put one tube in the urine and the motion passage, and they can completely check the pressure dynamics of how the bladder is working. So those tests, it is little bit bigger test. It is done only when the problems are very bad. Normal complaints, the tablets are fine.
ఇప్పుడు మామూలుగా ఉమెన్స్ లో ఎక్కువగా ఇన్కాంటినెన్స్ ప్రాబ్లం చూస్తాం సార్ ఆఫ్టర్ డెలివరీ అలా. ఇప్పుడు మెయిల్ లో ఇన్కాంటినెన్స్ ప్రాబ్లం ఉంటుందా సార్?
It can be there. So it is very important, women incontinence. Again, I feel in India is if women are having incontinence, they will not tell anyone.
Yes.
So they are shy to tell.
God gift we are using pads.
Yeah.
When there is no chance.
Yeah. They would. So if the doctors majority are male doctors, then they would not be able to convey it well, right? So incontinence, leakage of urine in female usually is of two types. One is called stress incontinence. One is called urge incontinence. Now, what is stress incontinence means? If somebody coughs, then the urine will leak, right? If somebody is laughing hard, then the urine will leak. Or sometimes when they are sitting and suddenly gets up, the urine will leak. These are called stress. So whenever the body got some stress, the urine leakage happened. There is something called urge incontinence. What is urge incontinence? Is like the patient will have urgency to pass urine. By the time the women reach to the washroom, some leakage will happen, right? That is called urge incontinence. Now the tablets which we were discussing, they help more in urge incontinence. Both are different. So urge incontinence happen when the bladder has pumped too hard. The stress incontinence happens when the sphincter is the door which prevents the leakage, right? So now because of the gravity, ideally the urine should fall down for all women, but it doesn't fall down because the door is always closed. If this door becomes weak, right, it is loose, then the urine leakage will happen. So the stress incontinence is problem of the bladder door, and the urge incontinence is the problem of bladder itself. So after the pregnancies and all, multiple pregnancies and all, this door becomes weak. So if it becomes weak, they will have this stress incontinence where the cough, the leakage is happening, and it will come little bit after few years that leakage will come. So there are procedures for that. Again, the procedure is a very small procedure. So we put a tape there and support that door area, right? And it is considered as a small procedure only, and it helps. So lot of women, when we do surgery, they will tell us that sir, for years I was having this leakage. We never went to any doctor, and now we got this surgery and the leakage stopped. So they feel that they could have done it 15 years back. Unnecessary, all these years they were using the pads, and the smell and all will be there. So this leakage of urine definitely has treatment. So either it could be tablets or it could be this tape surgery, but
Okay.
definitely should do some test and see. So they might be surprised that the treatment was very easy and they never tried to take it.
ఓకే. ఈ ట్రీట్మెంట్ చాలా టైం పడుతుందా సార్?
No, it is a small the tape which I am telling that when the leakage is too much. So surgery we do only when the problem is too much.
ఓకే.
A little bit urine or leakage on and off, we will give some tablets. But there will be patients who will leak on an everyday basis. Every time they cough, they will have leak.
Yes.
Right? So for them, surgery is
required.
good and it is required. That surgery, see, we do the surgery, next day the person can go home, right? A urine tube will be there 1 or 2 days, the tube will be removed,
Okay.
right? And the tape which we place, no, it will not be placed very tight, because if you put tight, the urine will completely block.
Okay.
So it is kept little bit loose knowingly, and over the time the tape effect will improve. So as the 3 months, 6 months time period will go, the control will come more and more.
Okay.
So usually in 3 to 6 months we see that there is absolute control of passing.
సో సైకలాజికల్ గా గానీ స్ట్రెస్ ఇంపాక్ట్ యూరిన్ పైన ఉంటుంది.
It will
It will be.
So because
It
we
will be.
discussed, no, because that the brain always talks with the
Yes.
bladder, that what we are supposed to do. If your brain is not in a correct position, then it can definitely not work well with the bladder.
Okay.
So all things should be sound, the organs should be sound and the brain should be sound.
Okay.
So lot of anxiety, depression, right, that definitely can affect bladder mechanics, because the control has to come from the brain. So if it is because of the neurological cause, then we should treat both. So there are some tablets which will act in the bladder and there are some tablets which will act in the brain.
Okay.
So we have to act on both the sides. If you just treat one thing, the other thing might not
Okay.
improve. But if it is just because of the anxiety and all, definitely the tablets will help on that, and those are tablets with not too much of side effects. So depression and anxiety and all, usually as urologist I will not be treating, so I will suggest them to meet the psychologist or neurologist, and they will help in that. Whatever the brain thing, the bladder treatment would be there, that would be from our side. That's it. It is always good to work with other team doctors also. That is what it is always. Then we can give a better treatment to the patient. So always female incontinence comes in mind, because it is far more common than in males. But male incontinence is also there.
Okay.
So imagine that urine is leaking, right? Now, if in your house, if water is leaking somewhere, what problems could be? Either the tap is not working well,
Yes.
that is why the water is leaking, or the tank in the terrace is completely full and
Full,
then it is leaking.
overflow.
Both are completely different things. So for a male, if the leakage of urine is there, one reason could be the tap means whatever the muscles are there, the sphincter muscles to stop leakage of urine has become weak. If the
Okay.
sphincter is weak, the urine leakage is happening. One thing.
Okay.
Second thing, that area is very tight, the bladder is completely full, and now overflow leakage is happening. Right?
Okay.
So they both are different things. That is why we do scans and first confirm that is it overflow because of the blockage, or it is because of the weakness of the sphincter. Right? Majority in the male who didn't have any surgery, the reason would be overflow.
Okay.
Most common reason being prostate. Right? So after the age of some 50, 60 years, there will be enlargement of the prostate in all the male. So as the age will progress, the prostate will enlarge. It will block the passage of urine. The urine will get accumulated in the bladder, and after being filled, it will start leaking. Right?
Okay.
So that is one reason when the urine leakage will happen in male. Second reason, if the sphincter can become weak. Now, when the sphincter can become weak, one of the important reason is after surgery.
Okay.
So when some prostate surgery is done, the sphincter would be just near the prostate. And if there is some surgery around the sphincter, it can become weak and then it can lead to leakage of urine.
Okay.
So any person who is getting a prostate surgery, there is some chance that urine leakage can happen after the surgery, but the chances are less.
Less
They are
in
very-
males.
So prostate surgery will be in males only. So the chances are less. We should not worry too much. In more than 90%
Okay.
of the surgeries, it will not happen.
Oh, okay.
But it is still our duty to tell that it can happen, and but imagine that 99% didn't get, but I am the only 1% who get the leakage, right? So I have to
Yes.
tell the patient that
Okay.
this can happen, but should not worry too much about it.
సార్ ఫైనల్గా మీ సైడ్ నుంచి
Hmm.
యూరిన్ ఇన్ఫెక్షన్స్ కంట్రోల్ చేసుకోవడానికి మీరు ఇచ్చే అడ్వైసెస్ ఏంటి, సజెషన్స్ ఏంటి, ఎలాంటి ఫుడ్ తీసుకోవాలి?
So urine infection as such more problem of women, right? So first of all, I think most of the women know this, that to maintain as much hygiene as possible. Sometimes it is difficult because when we have to use some public toilet and all, then it is difficult. But we need to be at places where it is the cleanest, because the urethra in female is smaller in size. So any infection even around the side of the skin can go to the urinary tract, can cause infection. Other thing to prevent, I would suggest, this is little bit important to understand, that in small girls, right, when for example a less than 1 year old girl,
Okay.
when the cleaning is happening, so when the girl will pass some motion, right, the cleaning should not happen from the motion area to the urinary area,
Okay.
right? This is very important. I have a small daughter, so I would like to educate people on this.
Okay. Okay.
So how we are supposed to clean when a small baby passes motion is always from the direction of the
Down
urine
to-
area towards the motion
Okay.
area.
What?
And if I'm using some wipe to use it, once I go from the urine area to motion area,
Okay.
the motion has touched it here, I cannot go back to the urine area,
Okay.
right? Because the motion should not touch that area. So once I have
Okay.
gone there, this has to be thrown. So always that direction has to be maintained, and the girls should also be educated
Okay.
that even when they grow up, the cleaning should happen in this direction. So that is one basic thing. Using public toilets is important. More important is having good hydration. So
Okay.
always understand, the more and more water you are going to take, it is going to dilute everything. So even if the infection is there, the infection will get diluted, the bacteria will get diluted, and it is easy to treat,
Okay.
right? Recurrent infection, you can use the cranberry juice if possible, the lemon juice if possible. Again, it changes the pH of
Okay.
urine. So these are I'm trying to advise the things which can be done at home without
Okay.
medical doctor treatment and all. So other things are, if somebody is diabetic, right, be very serious about diabetic control,
Okay.
right? Because people think that even if I don't take diabetic tablet, I am absolutely fine. So if I take, even if my sugar is 300 or my sugar is 150, I feel absolutely normal. All these things will be coming after 10 years. Now you will feel everything normal. After 10 years, you will realize what the problem is there with the. So if the sugars are not under control, infections are going to come back. There is no question. You treat it now, again after some months, infections are going to come back. And urinary infection can anytime go to kidneys. And if it goes to kidneys, then you will have to get admitted, have to have IV injections, and sometimes need to put stents, and problems are there,
Okay.
right? So these are in general. See, diet per se, we have not seen that if you eat this thing and you will get urinary infection. But we have seen some people are very much sensitive to some diet. Whenever they take this diet, they get burning in urine, right? So lot of, so if you have a particular diet which is causing you that, then you can avoid it.
Okay.
But there is no proper scientific evidence that this diet will cause to urinary infection or any burning in urine per se.
Okay.
So these are the major things can be taken care. And if it is fever is there, you are supposed to meet the doctor. If the burning continues for long, you meet the doctor, do the urine test, urine culture, take some small antibiotics, and that's it. I would suggest people not to take antibiotic by themselves, because nowadays
Okay.
people know some antibiotic. You
Yes.
can do ChatGPT and take some antibiotic.
Google.
So what can happen is, if unnecessary you lose so many antibiotics, over the years the person will become resistant to most of the antibiotics,
Yes.
which might affect their future. Right now they might be fine, so this should be avoided if possible.
Okay. Thank you so much for
Thank
sharing
you,
your
and
knowledge. Thank you.
happy to be part of it.